I would like to ask you by the screening programs for smoldering monoclonal gammopathy. We know that there are a lot of screening programs for other cancers. Is it the appropriate time for doing this in plasma cell disorders?
So it's such an amazing time for us to ask that question. As we start thinking we should treat smoldering myeloma and we can make a difference in the treatment of smoldering myeloma, you start saying, well, are we finding those patients incidentally? Is it by pure luck that one person was diagnosed with smoldering myeloma and now is being treated early? And can we prevent that? And if you think of all cancers, cancer screening saves lives. And how can we make a difference for those patients? We can do active surveillance. We can actually start thinking of early screening for everyone, and especially for high-risk people. We're not saying we're going to screen the whole population. We're saying let's screen high-risk individuals, people who have a potential 10% or more chance of having myeloma at an early stage. And if they have very low risk MGUS, it's fine to know about it and watch it carefully once a year and be careful about it and prevent progression. But if they are smoldering, if they have a chance of developing myeloma in the next 2 years, 3 years, let's do something about it and intercept it early so that we can prevent myeloma from happening. And I truly think if we screen, just like in the PROMISE study or in the iSTOP study in Iceland, we can make a difference in the survival of myeloma. And someday we may actually never diagnose a patient with active disease because we find it early through screening, which is very simple, a blood test, and we diagnose them and intercept early when they still do not have any symptoms. And that could be the way to cure multiple myeloma.